Let me share my screen. Hello, everyone. We're going to take a moment and let folks come in. We still have people filing in. We're going to just take a minute or two, but thank you for joining us on this Thursday morning or afternoon, depending on where you're calling in or dialing in from, or I guess clicking in from. Some new and old, or some familiar names and some new names among our attendees. So it's great to have such a diverse group. Just give it like 30 more seconds. All right, well, we will get started. Thank you all very much for joining us this afternoon, or like I said, later this late morning, for our Hepatitis B United, or sorry, Hepatitis B Foundation and Hep B United webinar on Snapshot from the Field. So this webinar really is taking a chance to look at what some organizations from around the country are doing today, this Thursday, or really just in this kind of period of time. So many webinars are looking at what's happened and analyzing the past, or maybe planning for the future, that sometimes it's really important to just take a look at what we're just doing in this moment, how it's going, if the barriers are still being the barriers they usually are, if we're seeing incremental progress that we can celebrate, or finding new or unexpected challenges, just as a way to really get a snapshot on what's happening in this moment. So this is in a webinar format. And I am sorry, I do this every time. My name is Frank Hood. I'm with the staff at the Hepatitis B Foundation, and I also direct Hep B United, our coalition that I will go forward. Coalition that has more than 50 partners across the country. And our coalition is really focused on bringing together those doing the work to raise awareness and promote prevention efforts, and including screening, vaccination, and linkage care across the US. And we do this through a variety of capacity building programming, including webinars like this, where we elevate the knowledge and best practices of others, and field questions from those who are looking to get new ideas or help tackle problems. So this is a webinar format, so attendees will be on mute, but please do drop questions into the chat or into the Q&A window. We are recording this presentation, but those of you who are here, we want to definitely hear a robust conversation with. So please do be active. Just as you think of questions, drop them in, and we will field them as part of the panel discussion. So today, our three panelists who we have here are all rock stars in their own right. We have Dr. Amy Jessup, who's the Director of Research and Hep Trek at Prevention Point Philadelphia. We have Becky Nguyen, who's the Executive Director of the Vietnamese American Cancer Foundation in Orange County, California. That's just south of Los Angeles. And we have Dr. Ganyet Sarumi, who is the President of the African Health Coalition in Chicago, Illinois, just north of my hometown. So we are thrilled to have these three here, and I'm going to give each some time to further introduce themselves and their program. But we're going to, after that, we'll have a few moderated led questions, and then really be diving into hopefully a whole host of audience questions. So please start dropping those in. And with that, I will stop sharing, and I'll turn it over to Dr. Jessup.
Hi, everyone. I'm Amy Jessup, and I'm the Director of Research and HepTrek at Prevention Point Philadelphia. Prevention Point Philadelphia is a multi-service harm reduction organization working in Philadelphia, Pennsylvania, and we serve about 35,000 individuals a year through various harm reduction services, including housing support, syringe service programs, medical care, HIV care, Hep C care. We have medical case management and drop-in services and some drug treatment programs. With HepTrek is recently brought into Prevention Point Philadelphia. It's a nonprofit that we had for about almost 20 years at this point. And we brought it into and under the fold of Prevention Point, and that allows us to be a little bit more engaged with the group of people that are affected by viral hepatitis and within the space of harm reduction and substance use. But we also do other greater education outreach prevention programs.
Thank you. Dr. Sarumi, how are things in Chicago?
Good afternoon, everyone. My name is Ganiata Sarumi Diso, and I am the CEO of African Health Coalition. Responding to the numerous health risks and challenges facing African immigrants, including hypertension, diabetes, and hepatitis, with the death of 4 community members in 2019 of hepatitis B and C, here and abroad. The African Health Coalition, a 501c3, was incorporated to inspire community participation to solve chronic problems among African immigrants. In their ability to affect change and also respond to the threatening of chronic disease in our community, we visited faith and social organizations to gather interested community members, both young and old, willing to improve their health and the health of their community. In our ability to affect that, we found community members with all kinds of knowledge, professions, skills, and experiences. So collectively, we built ownership support. Some people volunteered their time, some gave medical supplies, and others shared their special knowledge. We involved the community in the decision-making, not as beneficiaries, but as partners. We developed a clear mission and a plan of action to inspire the community members to overcome empathy and initiate change. We use different strategies to inspire change in the African immigrant community. We appealed to the community leaders' emotions. We connected the community leaders with the community members, and also letting them know the impact, the serious impact of hepatitis B in the African immigrant community. We told the community members the possibility of having African immigrant community clinic tailored to their needs. When the community members finally buy in, after a couple of minutes, we engage them in various activities to keep the momentum going. We train community members according to their needs. We also reinforced ongoing instructions. Then we came up with different recruitment strategies to screen community for hepatitis B. So our strategies include 7 different strategies, phases. Phase 1 is the outreach phase, where we go to introduce African Immigrant Coalition services, our mission, and our vision to the faith or the community or organization leader. During phase 2, we do education phase, where we meet the congregation or the organization members. We do also, that is the time that we provide hepatitis B education in collaboration with Compassionate Care Network We screen for high blood pressure, diabetes, and with the help of other volunteers in different fields, we provide legal and financial services, health and life insurance information and registration, social service and advocacy. We provided this, or we are providing this, mainly because most of the African immigrant community, they do not know how to access or navigate the healthcare system. So on phase 3, this is the screening phase, where we go back there for the third time to screen those who have what falls in the screening phase. So that time, we provide them with gift cards, food, some of them with transportations, snack, or whatever that is needed for them to be able to follow up. So on phase 4, that is the result phase, whereby we mail all their results to them. Those people that are susceptible, we identify the nearest clinic that is convenient and timely for immunizations for them. And those who are positive, we connect them to care. On phase 5, and that is the post-screening phase, we follow up with phone call to the community members to see if they were compliant with their visits or their appointment. So phase 5, that is the post-screening phase. Phase 6, we follow up maybe about 1 to 2 months after screening. And phase 7, we return visit phase. We return to the organization leaders, sometimes to the congregation, to talk to them, to see how things is going, to build their trust and strengthen the relationship that we have with them. Over the years, we have some challenges. And those challenges include finances, some community members who buy out, because we do not take them as community members. We bring them in as partners. Some of them buy out, and some of them, because of finances, we are unable to do things that we're supposed to be doing or we want to do, and probably because of manpower too. We also have decreased in our volunteer group. So, but we have had some successes. One of our success stories is the progressive wellness of a community member that has been living with hepatitis B for over 35 years. We link her to services and she's doing well. Also, through our advocacy, we help a young community member with special needs to be admitted to a special education, and all needed services were activated. And this young community member is a niece to one of our community members who had hepatitis B positive. So we also made sure that we celebrate our volunteers and our community members. So to keep the momentum going among the community members, we celebrate victories and appreciate them. We share stories of how the work they do as the community, and then the response to health and health-related issues. We have made a lot of progress. We continue to make progress, and we're looking forward. Actually, after the COVID, we've been able to test more people than we normally tested. And that gives us hope that we'll be able to do more in the nearest future. So to our community members, our partners, we let them know that we appreciate them and they are gradually making a difference. So our collaborative organizations, we thank them for their support and services. And to our funders, we appreciate your financial and professional support. Thank you all for listening.
Thank you, Dr. Sarumi. You touched on a lot of great things. I was here taking notes because I want to follow up on some of them during Q&A. Becky, how are things in sunny California?
Good morning from SoCal, and thank you, doctors, for sharing what you just shared. It's really the grassroots organizations on the ground that are doing so much work. And VACF is, I'm proud to say, that started in a similar way. VACF stands for Vietnamese American Cancer Foundation. We were founded by a group of cancer survivors and local physicians who saw there was a need to address the cancer rates in the community. Cancer was, and unfortunately is still the top cause of mortality in the Vietnamese community. So we do a lot of the outreach, education, and then we do health navigation. We do facilitation of screening events. And then we also provide the supported and case management, care coordination in that way. For us, outreach and education is to have the weekly radio show in language hosted by our organization, and then also by physicians who have been in the community, have built up that reputation of providing the evidence-based, objective information, and not skewed toward one way or the other, but presented it in a comprehensive way so that the community can understand more about various diseases, particularly anything that is related to cancer and the cancer services in that respect. And then in addition to that, we have workshop, and then we have one-on-one encounters to share and educate more. But what we really are proud of is that we're out in the community. We are what we are saying, that we're out in the community. We go where our community live, celebrate, educate, shop, and and so we're out there really focusing on what is our need in the community. And one of the needs that we do see is to address hepatitis. And as we all know, I think I'm preaching to the choir, in that looking at each other, we don't know who has hepatitis B, C, or not. And so we encourage blood tests. In that way, we know our status, and that way that we could protect ourselves and protect the loved ones in the community through the ripple effect in that way. And then for hepatitis 2, it's linked to the liver cancer. And liver cancer is the second type of cancer causing mortality in the Vietnamese community. And so we wanted to address the educational piece and wanted to find paths to access care. And so we address all those needs along the way. And so, yeah, I'm excited to hear more from the community members. And so thank you, Frank, for having VACF as part of this conversation.
Yes, thank you all for coming and for sharing the incredible work you're doing. On a conversation about what's happening with hepatitis B, I'm going to immediately steer us towards things that aren't hepatitis B. And that's to say that all three of your organizations started with a focus that wasn't hepatitis B. Dr. Sarumi's was around chronic conditions, high blood pressure and diabetes got mentioned. Prevention Point was, started as a harm reduction organization and substance use disorder linkage, and then as in the name of VACF, and as you just said, very much a cancer focus though, but on each of these communities and needs found that there was extensive overlap with hepatitis B and a necessity to provide these services. So I'm curious how your kind of move to just doing a syndemic focus or a multi-infectious disease or disease focus has supported your hepatitis B work specifically. I'll go in reverse order. Becky, let's start with you.
Well, one of our co-founders, she's a gastroenterologist, a hepatologist as well. And so she saw that, hey, nobody's talking about hepatitis. And in her practice, she saw that this is a need to address because it's linked to liver cancer for the Vietnamese community. And the transmission modes are very different as well. It's majority of it is passed from unknown infected mothers to the child, and so we needed to get tested, and we needed the education. And then the other thing too is that for those who are hepatitis B carrier, they're very isolated because the family members don't understand that this is not passable through eating together. And as we know, with the Vietnamese culture, we eat together and we do share food in a family style. And so oftentimes the infected patient felt very lonely, that they're being told that you need to eat separately away from the family, or don't hurt your grandchildren, because that might be passing it through. And so we started to question, and therefore that's how the conversation began. It's just like, there's a lot of misinformation, and it's just by passing on from words of mouth and things like that. And so we said that we need to talk about it, and we needed to educate the community. Not only that, give them something more concrete in that, let's get them tested. And back then, getting tested is very hard. Insurance don't necessarily pay for it, and for many of our community members, they don't know how to ask for it. Because they just don't know how to start a conversation with their healthcare provider. And so that's how we began. And we also recognize that there's a linkage to, again, hepatitis B and liver cancer. And liver cancer continue to be one of those that haven't been talked about in what I call mainstream USA. But, we are all in this together. So we just needed to address it. And so that's how our newer, we call it newer program, but it started in 2005. And we continue to screen, and we screen thousands of community members. And we saw about an average rate, about 12% infected. And again, we continue to provide the education, and we continue to see that this is something is a need in the community. And then during the pandemic time, we double screen in that we are there as the community members are getting vaccinated. We took the 15 minutes to talk about hepatitis and encourage them. And then we do have a lab partner who is right there at the event to say, if you wanted to get screened and you qualify based upon what you had just completed in the survey, we send them over to get the screening. And for those who don't have the insurance, we would cover for that. And that is appreciated in the community very much.
Nice, thank you. Dr. Sarumi, how has your multi-disease approach, via education and screening, helped increase your hepatitis B engagement in the community?
Actually, like I stated, I did not start with hepatitis B. Although I work for Chicago Department of Health, and you would think that I would know the impact of hepatitis B, but I'm not in that section. So probably what we've been doing this for probably over 20 years before we were contacted. And what were we doing? Because I work for the city as a public health nurse, I decided to just screen our community members, only because most of them will come up to me because they know I'm a nurse. And then we ask me a question. And when I take their blood pressure, it's sky high. So I started doing screening all over the place, going from one faith house to another, going from one organization to another. And I did that for over 20 years, all by myself. I finally decided I'm going to call people when I was invited to a Muslim organization treat. And that was in 2015. I was invited to lead the medical team because they usually have maybe over 1,000 people there, and they stay there for 4 days. So during that time, I said to myself, there's no way I can do this by myself. So I went to the community, go here and there, visit places to get people, educated, not educated, because I know everyone has something to put on the table, So I got so many volunteers against all odds. And when I said that, what I mean is that a lot of people don't want me to call those people that were not educated. If you are not a nurse, they shouldn't be there. But I do know that I need everybody here and there. So we got them together. And because of that work that we did, up to today, I am the one that is heading that NCNMO organization, which is the B community Muslim organization. But that being said, for this hepatitis B, I was approached by Asian Health Coalition. I do not know how they get me, to be honest with you, but I was approached by them and they told me that they need to get into into African immigrant community for hepatitis B screening. So what I asked them is, how many people do you need? Because I really didn't know exactly what I'm going to get into. So they told us, whatever. So they got in, and that's how we've been doing this hepatitis B. And now we are able to get into this organization through hepatitis B. And why did I say that? Remember, I go from one month to another, telling them about chronic diseases, right? Now we cannot even screen ourselves because this hepatitis B has taken so much time. So we have to collaborate with other people. And during the time that we go there, we have Compassionate Care Network. They are the one that come in and do the screening for us. During the time that we go for education, we have people asking us questions about their insurance, about their immigration, about social services, about their health needs, about their life insurance. So we have some professionals now that work with us. They go with us during the education phase. And this education phase is the one that takes a longer time. So we have to provide food for them. So we go there, and because of that, we are able to screen more people. And then when we screen them, we give them, cards, gift cards, sometimes bus tokens, other times just the food, and people are coming. So I can tell you that this hepatitis B has paved way for us better than what we used to be. And now it's people that are calling us to come here and there to give them this education and screening.
That's great. Thank you. And I mean, yeah, that is definitely a syndemic approach, but having Hep B lifted up as part of it. Thank you for sharing. Dr. Jessup, how has prevention points kind of move into this more syndemic focus help lift up the Hep B specific work that's being done now?
So I would say that at Prevention Point, the focus, I think most people would recognize, the risk to the risk for hepatitis B to the people that we serve, comes primarily from the sharing of injection drug equipment. And I think that many people forget about the aspect of sexual transmission or transmission through other means of bodily fluid sharing. And I think that that's something that at least I'm trying to make sure stays in the forefront at Prevention Point, that even though we are part of what we do there is to do needle and syringe exchange so that people in the community that are injecting drugs have clean, sterile needles and syringes each time they inject, that there is risk beyond that, for transmission. So that's one thing that I've been trying to make sure that people remember and recognize, as they go about our daily interaction with not only the people we serve, but the people that we then inform around the community and around the country. I would say that it's a little bit challenging to keep hepatitis B on the radar. The last time we checked, prevalence of various conditions within Prevention Point, hepatitis C is just, dwarfing everything else. A majority of our participants have active hepatitis C infection or have been exposed in the past. And so that sort of, absorbs most of the energy and much of the concern, as does the risk for HIV and HIV care. So it's a little bit of a challenge every once in a while to make sure that we keep hepatitis B on the radar. And one of the reasons I think that is that we don't have a rapid point of care test for hepatitis B. So we do have those for HIV, we do have those for hepatitis C, and that helps us, I think, our staff and participants and others in the community recognize the need for HIV and hepatitis C services, and the need for right now a blood draw clinical laboratory for many people who don't have insurance or whose insurance isn't going to cover that, or they don't want to sit for a blood draw and come back for their test results. I think that limits the awareness and the concern about hepatitis B in the harm reduction community. So that's something that at least my group is working on right now. And I know that as we speak, there is a hepatitis A outbreak in our community. So that is increasing awareness that there is other infections other than hepatitis C in our community, and it's bringing in people and the local health department interested in vaccinating. And then when they come out for vaccination for Hep A, they're also including hepatitis B when they can. And we, for the patients that we serve through our hepatitis C treatment program and our HIV treatment program, we are able to provide Hep B screenings and testing, and we are able to provide hepatitis vaccination for those people, but it's not a widely available set of services at our facility right now.
One quick follow-up question on that. Are you able to share what percentage of the folks that you've seen test positive for Hep C and that have come back to do their Hep B screening ahead of starting treatment? How many of them end up being co-infected with Hep B?
I don't know.
All right.
Yes, I don't know today. I know that for the HIV participants, it's a small percentage also have hepatitis B. And by small, I would say 10%, and that's like off the top of my head. For the hepatitis C participants, if anyone is interested in treatment for either their HIV or their Hep C, they are tested for Hep B. I don't know the co-infection rate for Hep C off the top of my head, but I don't think it's super high. I think it would be high in another setting. Someone would be like, oh my, but given the prevalence of Hep C, which is, sometimes 60 to 80%, depending on the day, I think the magnitude of the problem gets kind of dwarfed, but I think it's real and probably much higher than the average community. Yeah.
Thank you. And I think also, a great point on, because when you're starting HIV or Hep C treatment, that test is necessary. Like just a great opportunity to get to flex a different, linkage aspect to get the Hep B information kind of added. We certainly at the foundation look for those opportunities as well. Each one of you have mentioned in your various pieces about ensuring the ability to provide competent or compassionate care. And I was curious, and I'll start with you, Dr. Jessup, and work backwards. You are either in a place that has providers or are directly linking to places with providers. How do you make sure those providers are providing competent care with the folks you're sending their way? And Dr. Jessup, you mentioned the fact that making sure it's still on the forefront of some of your folks, that it's not, C or B is not just passed via drug use, but also other methods. How, beyond just that particular fact point, how do you kind of go about ensuring the providers need to know what they need to know?
Well, that's a really tough thing, in large part because of the stigma that our participants face. People are quite hesitant to, our participants are quite hesitant to work with the traditional healthcare providers because they feel that they're judged and there's stigma towards them. It's real and it's perceived, so we do have providers that come to our site that we know and we interact with them. So we help them understand the harm reduction approach and the issues that our participants face. And so from the day-to-day interaction with the folks who provide care on site, we can assure that culturally appropriate care is provided. when it comes to linking people to providers that are outside of our orbit, that's much harder. And we do have some medical case management that can step in, especially for our folks that have HIV, and in Hep C care, try to link them with providers that we've gotten feedback from, from our other participants about their care. But it's been pretty tough to find people who specialize in hepatitis B treatment, who are accessible to our participants, who don't have necessarily transportation, and to just find those in general, and then those that are willing to accept the patient that we would be sending forward with all of the social issues that come with it. Yeah, so it's been tough to do that, and we've been working with the Hepatitis B Foundation on planning a Hep B screening and hepatitis Delta screening activity in our community. And one of the things that we're struggling with right now is, so where can we link people to make sure that they get not just good care for hepatitis B and hepatitis Delta, but that it's culturally appropriate, and that our participants will engage with those providers. So that's been tough, and it's mostly word of mouth and communication with different healthcare provider institutions. Yeah. Does that answer your question?
It does, yeah.
Okay.
Like identifying the barriers to being able to provide that care is, one of the important steps along the way to ensuring that care is met, right? So the fact that you've recognized it, you're actively trying to combat it, and running into, it sounds like, again, one of those things of why it's important that our medical or healthcare staff represent or very much represent our population nationally. It's hard when we aren't able to have doctors that can necessarily relate, or haven't taken the time, or do have the perceived or real stigma around certain community groups.
Yeah, I want to add that historically, it had been difficult to get people health insurance, that are participants at at least our syringe service program and our other harm reduction activities. With Medicaid expansion, it became easier to get people insured via Medicaid, but that's also changing as post-COVID protections are being taken away from Medicaid participation. So I think it's going to be harder in the future to get people tested, to get testing paid for, and to be able to link them to providers who can see them either with the kind of insurance they end up with, or if they're uninsured. That's tough.
We are very much concerned as well, and also, I mean, both with individuals losing health insurance with Medicaid, but also the fact that there are many now community health centers and other CB or community-based organizations that will continue to provide COVID testing and vaccination services, but won't have the same funding sources to do that. And so that's now going to start eating into budgets that they might have been using toward other outreach opportunities, including hepatitis. And so it is, another chronic or widespread condition that is not resourced well enough, before the public health emergency is actually ended. Dr. Sarumi, we were speaking yesterday, and you mentioned that actually for similar reasons around insurance access, that you do a lot of linkage to your local federally qualified health center. What sort of outreach or work do you do with that health center to ensure they're able to properly handle the patients or the individuals you're sending them?
Presently, Asian Head Coalition is involved with most of those FQHC that we send people to. And some of the others, we send them to Chicago Department of Public Health. Others have their own physician that they like to go to. And sometimes what we do, we don't reach out to their physicians, but sometimes what we do is to find out what's going on, how they're doing, and how comfortable they are with the services that they are getting. The ones that Asian Coalition have services to. So thanks to Asian Coalition, I don't have to do that outreach myself. They're doing it for us. So the ones that they are able to reach out to, Those are the FQAC clinic and also the community clinics that are free. And I believe one of the reasons why we use them is because of the fact that a whole lot of our community members don't have insurance, and the FQAC only, kind of ask them for a minimum fee to pay. If they are unable to make that payment, we go ahead and make the payment for them. So just like I said, we ourselves as African Health Coalition have not been able to make a direct link by ourselves to these providers at all. We go through Asian Health Coalition.
Hey, leveraging another partner in the community is a good best practice, and so I'm glad to hear that you were able to work with someone who had those relationships and that they're willing to push the those FQHCs, and
Yes.
the Asian
And
Health
if-
Coalition is great.
If I can add to that too, they come, Asian Health Coalition invites them to the clinic, to the meeting sometimes with us. So they come out and talk to us how they are doing what they are doing with our patients and all that. They do not disclose what they are seeing, but they tell us about their services. And also I remember that right now, University of Chicago medical students, they also have opened up a new clinic too that we are using, that Asian Health is using for this too. So they come and give us a brief overview of their services and the support that they're giving to our community members that we send to them, including Heartland, who is now Tapestry.
Nice. And Becky, you flagged the fact that the ACF started with a provider recognizing there was a need in the community. So I imagine culturally competent care has kind of been on the forefront from day one, but how, what is culturally competent changes with time? And so how, I guess, do you continue to make sure you're providing that care? And, I don't know if there have been changes within your community, maybe even with drug use or other things. If there has been, how do you make sure that it's still, you're still able to respond in that way?
For us, we are not a clinic, but we work with various community clinics, including the FQHCs here, who are focused on the community with us. And then in addition to that, the providers, it's a good thing that we're founded by a provider, a few providers. So their network became our network. And so when we're making the linkage to care, we refer to those that we have basically have the connection with and have already worked with in various capacity. Some of them are presenters for us. Some of them would be at the event with us to provide the talk. And then what we also do is that we have the follow-up to the after the screening event. And then, so with the GI would be there and do the presentation again to emphasize the most important points to take away, and also be available to do a one-on-one consult and explain what the results mean to them. And so for us, the linkage to care, and for our staff, patient navigator, health navigators, we follow up just to make sure, just to reiterate the importance of getting connected and getting the care, and reiterate again and again that how important it is to monitor, to follow through with the treatment. And also we have champions who have been through the whole process of the treatment. For example, one young lady, when she lost her health insurance, she decided not to take medication anymore. And then next thing she knew, months afterwards, it came back with a vengeance. She would see all the symptoms that she thought, oh, you know what? The physician probably didn't know about my case, and that's why they just give medication prescription arbitrarily. But once she was off medication, she saw all the symptoms. There are yellow eyes, yellow, skin, dark stool, and all of that. In the end, she ended up being in the hospital. So for us, we asked if she could be our champion and share that story, and then connect them, and making sure that the patients are compliant, and for us to connect and making sure that they are getting the care is the case management. Just follow them through all the way through, and be here and really ask the other who have gone through the similar journey to be the mentor, to emphasize that you need to stay on with the treatment that is being prescribed for you. And for the providers, we stay connected. We check in, we ask if there's anything that we could provide to support. And most of the time, they appreciate the fact that we have the time to talk to their patients, explaining the importance of it, and also addressing other social determinants of health too, including insurance or food. And so we're here, we're really here trying to be that, what we want to call hub and spoke kind of model, to centralize it and to be the partners with our providers and with our clients, patients, so that they have the best outcome as possible in their treatment.
It's very comprehensive. And how to ensure proper care. I mean, we're coming up to the last 15 minutes. I'd actually intended this next question to be our very first one, but dove into some of the other pieces. So this is actually gonna be a little bit of a two-part question. I'll combine two, and we'll start with you, Becky. What is your next event coming up? It could be tomorrow, next week, whenever it is. And how, I mean, I get it, you're in SoCal, so you really don't have changing weather, but
We do.
for Amy and the second part of this question might be more relevant. How has the changing weather changed your programming for the next few months?
You know, we celebrate spring, not just Lunar New Year, but spring. For us, you know, during the time that our cancer patients went through the treatment, it's very dark, very cold, almost like they're going through winter, very isolated, and spring just comes with new hope. And so we are fully in bloom. We're doing screenings left and right and going out in the community at various events. For example, this weekend, we have the clinical breast exam event to talk more about breast cancer in the community, and also volunteer physicians doing the clinical breast exam. And as we're there with the community, we also connect them to mammograms if needed. So that's happening on Sunday, but on Saturday, we have a big Easter event for the Vietnamese community, which usually draw about 500 community members. So we're out in the community at the park. Hopefully it's beautiful and sunny, to educate the community some more about health and how to stay healthy in that respect. But we're also taking on another challenge, is to address the aging, disability, and also mental health as well. So we're coordinating a few major health health fair / resource fair for the community. And it's not just for the Vietnamese community anymore. We are opening this up for all. And we even have staff who are able to speak Spanish. And then we also invite partners who speak different languages, so we could come together and really address and improving our whole community health in that way. And so we're just happy to be a partner with Hep B United and Foundation, to be part of the conversation and continue pushing on the conversation of hepatitis in our community.
I love that you all celebrate spring. That's great. It's the cherry blossoms here in DC are blooming, so it very much feels like spring. And full bloom is a great way to describe it. Dr. Sarumi, what's your next event, and how is it being less snowy and a little bit warmer in Chicago impacting your programming?
We do have a platform that we started back during the COVID time, and we started because of COVID. because during the COVID time, we were not able to go out, people were not able to come to us. So we had a platform, and that platform has been ongoing since then. On that platform, we meet the first Sunday of every month. So that is coming up this weekend. On that platform, the best part of it is that anyone can join from anywhere. And people join and they ask questions. And actually, through that platform, we were able to be connected with the E-Rotary Club of Greater Nigeria. And that club are bringing their members to the platform and also being able to disseminate the information that we give them, bringing us more people. Apart from that, we are also planning a health fair. It's going to be summertime soon in Chicago, and we are really looking forward to that. And this is the first time that we will be having a health fair outside. So we hope with that, it will bring us out there. More people will attend it. That's what we're hoping. We hope we can do it outside, and if we cannot, we will do it inside in a big place. And with that one, we are also planning to collaborate with another community organizations, probably maybe 2, 3, 4, whoever can join us so that we can have a bigger event. So we are really looking forward to that.
For those of you who've never been to Chicago in spring, it gets really, really pretty. Especially if it's like a little bit, I mean, it's windy, the windy city, but when it's cold, but you're in the sun, you end up being like nice and warm. So a little homesick. Haven't been back in a bit with the green, all this greens. Yeah, nice talk. Dr. Jessup, Philly, similar climate. What is your next event, and how has the changing weather changed your programming?
I wouldn't necessarily say that changing weather changes our programming all that much. I think we do have more people that are out on the streets that will drop in to our facility, and it's a little easier. There are more people on the street, so it's easier to find them, to take services to them. But what we have coming up, I alluded to earlier, was a project with the Hepatitis B Foundation, in which we're going to be doing 500 hepatitis B and, when necessary, hepatitis Delta tests within our participants at Prevention Point. And that's going to allow us to identify a little better the prevalence of Hep B and hepatitis Delta in our community, and identify those who are in need of vaccination. And hopefully we can work with our providers to get them vaccinated, and those that we identify that are positive for Hep B or Hep Delta, to get them into care with one of these providers that we're working hard to identify as good providers for them. That's our primary thing. I've also finished up a project looking at hepatitis B related activities in harm reduction organizations across the country, and finding really pretty limited actually activities going on. Some facilities are doing a great job. Most of those are large ones like Prevention Point that have connections with a healthcare institution. Most of the smaller ones are doing little, and mostly because of funding. But I'm hoping that with all the activities that we have going on, not only can we increase awareness about hepatitis B within the harm reduction community, but also demonstrate the need for services through this screening activity that we're doing. Most sites are not doing any screening or testing for Hep B, so they really don't know. They often would say it's not an issue here with our participants, and I ask if they do testing, and they say no, and how would you know if it is? So that's something that we'll be working on in the coming year.
That's great, and it's interesting, those those few programs that sometimes do have a chance to bring someone in to do some testing often come back and say like, oh well, when we test for it we find it,
right?
So it's, yeah, you have to look. So we have just about 5 minutes left, and I had to save it as our last question, and I actually love that Dr. Sarumi already sort of touched on it a little bit, which is we have to lift up our wins, especially those small personal wins. And so I was going to say, is there a great like win that you have to share? It can be like large and programmatic, or it can be just an individual that you saw, advance somewhere along the care continuum or something else that you can share. Obviously, no personally identifiable information, but just a win you can share, and we can wrap this great conversation up with 3 happy examples. So Dr. Jessup, we'll start with you.
Our wins. I would say, being able to talk with people around the country and this increased awareness about hepatitis B in this community has been great. Through the conversations we had with the harm reduction community, just really opened eyes. So many people said, oh, I don't really know anything about it. Is that a problem? And so they've started asking questions, and hopefully we'll be able to get materials out to them soon to help them address hepatitis B in their community. So I look at that as a win. We've increased awareness within a community that was lacking it. And that's the first step to moving forward and giving some services.
Yeah, absolutely. Thank you. That's
Yep.
most certainly a win. Dr. Sarumi, you provided a fantastic example earlier, but other wins that you can share.
Yes, it's a sad situation, but it's okay. Recently, we went to give an education at an organization, one of the faith houses. So during that education, like I said, we usually take with us for other providers or other professionals. So one of the people that was there contacted us after the education because there's someone in the hospital that had an accident about a year ago and still hospitalized with no insurance. So she contacted us to see if there's anything we can do. So we talked to our volunteer, the insurance guy, that's what I call him. So we spoke with the insurance guy and he was able to help. But we didn't stop there. Through him, we have been able to be connected to 3 different churches. And honestly, we did not start with hepatitis. We just did out of kindness. But his church members, they took that upon themselves. And for them, when they knew that what we do in the community is to screen for hepatitis B, they are the ones that are just putting out their words of mouth, letting people know how serious this is. So they've taken it away from us, helping us to just get places to screen. And actually, they did not stop in Chicago. They have gone to other states, telling them they can be screened. And so we've been receiving calls for other people. And we cannot even stop going to visit the guy in the hospital. So we make it a point of duty to go there at least once every other weekend to go and see him. And I just hope that he's doing better. It's hard.
Thank you for sharing. Becky, close us out. A win.
Oh, that's what keep us all going, right? And I have mentioned about that one particular hepatitis patient being very lonely, being very scared, and through our education with the whole family, he was folded back, welcomed back into his family. They're able to share meals, hugs, and use the same chopstick, things like that. And so that's important. And I think for me, it's just that, communication is so important. And as long as we could facilitate that and build that bridge, is a win for us. And then the other win is more in the advocacy world. We're part of this whole movement in Southern California, advocating for testing for hepatitis B. And so we're keeping our fingers crossed that it will be finally going through with the budget and all of that. We heard, the budget is having issues, but we're hoping. We all have been part of it, and it's a lot of advocacy, a lot of work toward that. And so we're hoping to see that win come this July. And so we'll keep you up to date. And I think you've been up to date, Frank. And so in everything that's happening about hepatitis B. But yeah, and so that's our win. And we're looking forward to working and meeting all of you. I just want to say thank you. Thank you for being part of this coalition, and thank you for sharing your thoughts and your ideas and your hard work. Sometimes it feels very lonely in that you're talking about a topic that nobody really wants to talk about. And it's just, I feel very appreciative. For me, that's a win. I really do appreciate all of you and all of your work. Thank you.
Great way to end this, y'all. Thank you to everyone for coming, and thank you for our three just fantastic panelists. I'm going to make this short. This has been recorded. We will get this posted on the Hep B United website and kind of announced through our various newsletters and whatnot. So do please keep an eye out. In general, just keep an eye out on the listserv, on the newsletter, and on our social media for just a host of upcoming webinars, promotion of useful resources around vaccination and screening, as well as a number of other events. We often promote our partners events as well. So thank you all very much. And I hope everyone has a chance to go and enjoy some nice spring weather.
Thank you very much.
Thank you. Thanks.